Dr. Ashi, we have here today. Thank you for coming on, Dr. Ashi. So my first question is, how have you been?
I'm good. I'm good. How are you doing?
I'm not bad. Thank you for asking, because not all my guests ask how I'm doing. But yeah, it's a pretty chill Sunday on my end. Yesterday I was with my friends the whole day. Yeah, it was a pretty chill Sunday so far. Do you have a long week planned this week or?
Yeah, I mean, I guess my work week is pretty busy. I mostly see clients in private practice. So on top of that, I supervise training psychologists and I do some of my own content creation. Just kind of started with that a few months ago, but try to uh try to do some of that as well. So
Oh,
my
you
my
just
weeks
started
are
that
pretty
a few
busy.
months ago.
Yeah, well, it's probably been a little more than that. I work for a private practice in Chicago, called Core Center of Relational Empowerment, and we're a group practice that focuses on family systems and multicultural work with clients. So we see a lot of diverse clients, we see a lot of families, and I thought it would be cool to start a YouTube channel for the practice. And so the first series I've been doing, I don't know if you've heard of couples therapy. It's the Showtime and Paramount Plus. It's with Dr. Orna, who's a New York-based psychologist,
Interesting.
and it's real therapy. They're doing therapy with couples. Each season is following a few different couples, and so we have been reacting to the show. Me and Dr. Amanda Rios, who's the owner of the practice. And yeah, so we watch each episode and then we react to it. It's for educational purposes. So we talk about what we like about it. We talk about what's going on that we see with the people on the show and kind of give our perspective as well, because it's a little different from Dr. Orno's.
Interesting. And your YouTube channel is actually how I found you. That's the
Mhm.
way I reached out, and I thought the topics you were talking about were very interesting. So yeah, let's get right into it, Doc. You wanted to talk about communication skills or Gottman based approaches. So tell me, because I'm pretty ignorant on this topic. So tell me,
Mhm.
what exactly is Gottman based approaches?
Yeah, so part of what I work with a lot of couples, and there's psychologists John and Julie Gottman.
Hmm.
They've created what they call Gottman couples therapy, and their work is based off of decades of research that they did, basically observing couples. And they watched couples and they looked at what worked and what didn't work, and
Hmm.
which couples stayed together, which broke up, and they noticed certain patterns. And so I noticed the same patterns.
Interesting.
So people come to couples therapy, and oftentimes these patterns appear. And so what they developed was the four horsemen of communication. And these are four aspects of communication that we do. It's honestly not just in couples, but in general in life. It could be
Uh-huh.
friends, family, colleagues, strangers even. And in the context of couples therapy, when they see these four horsemen appear, uh, sometimes one of the four horsemen, which I can talk about, depending on the study, it predicts divorce rates of at least 90%
Wow.
and some up to 100%.
Wow.
And yeah, I can give you the rundown of what
I
the
would love
horsemen
that.
are.
I
And
would love that, yeah. Because this is all new to me, so I'd love that.
okay, yeah. So um yeah, so first I'll get into the horsemen, and then what we do next in couples therapy is the antidotes to the four horsemen.
Very
So they're
interesting.
very specific interventions and tools for communication that, in my experience, and I think the Gottmans would agree, and all Gottman therapists and people that use this, when people use it the correct way, effectively, and consistently, it makes a massive difference in the functioning of the relationship. And I do it all the time. I have a level one Gottman certification. Haven't done the rest to become a full full level three.
Uh-huh. Uh-huh.
I want to get to it. It's pretty expensive, but
Yeah.
I do a lot other than couples therapy. But I use the four horsemen and the antidotes all the time. So any of
Mhm.
my clients, uh, if they could see this, they'd be chuckling probably because I do it so much. Um, So yeah, I'll talk about the horsemen. So the first horseman is criticism.
Interesting.
And
Wait,
what
why do you call them horsemen?
I'm not sure. That's what the Gottmans call them. I think it's just
Okay.
taken from like the four horsemen from the biblical stories.
Okay. Okay.
But there's four of them, and they're just negative, and they basically, if you use them consistently, it's according to the research, your relationship is doomed.
Interesting. Okay. So criticism.
Yeah, so the first one's criticism. What criticism is it's a you statement. So it's saying you're doing this thing. It's often an overgeneralization and it's not accurate. So it might say, you never do this or you always do this. And it's blaming and accusatory. So an example that might be criticism is you come home and your partner has not taken out the trash. And so you might say, God, you never clean, you never take out the trash. That's a criticism.
Of course, yeah.
And so the main features of criticism are that it's a you statement, it's blaming, it's almost always inaccurate because it's spoken from a place of anger or frustration. It can
Emotions.
emotions, yeah. I mean, it can be from sadness as well.
Uh-huh.
Um, but it's overgeneralizing and it's a criticism of your partner. The next horseman, which is the most damaging for relationships, is contempt.
Contempt.
Yeah. So what contempt is it's demeaning your partner, it's putting them down, insulting them, and it's often coming from a place of superiority or trying to humiliate your partner. So it can be added to criticism, right? So you might say, "You never take out the trash. You're so stupid." Or I can't believe I'm with you. I can't believe I'm with someone like this. So it adds another layer of contempt to the criticism, and that's really, really damaging.
Can I
There,
just slip something in really quick? Because
yeah.
I feel like sometimes when people feel inferior, that's when the contempt kicks in. So I'm
Mhm.
wondering, is it really a place of superiority or like masking inferiority?
Yeah, I mean it's a good point on a deeper level. People who need to feel superior to other people often actually feel insecure.
Yeah, yeah, yeah,
And so it becomes a defense mechanism for their
yeah,
own sense of self.
exactly.
Um, and that's kind of like a deeper analysis, right? You could talk about people who are narcissistic,
Yeah, yeah, yeah,
that they have this grandiosity about them, this
yeah,
superiority, and it's often masking or covering for deep down feeling very insecure and
yeah,
having a
yes,
low self-esteem.
yes.
Yeah, so it's interesting to see how that shows up in relationships. I think it doesn't always come from that in
Mhm.
relationships. I think sometimes it can come from resentment. It can come from this is how my parents talk to each other. So it could
Uh-huh.
just be a habit of communication. Um, it can come from sarcasm. So it can be a kind of passive aggressiveness. There's lots of different reasons that someone
Uh-huh.
might be contemptuous in a relationship.
Yeah.
Now, I have seen couples who have contempt and they actually realize that they have it and they change it. So just because someone has contempt doesn't mean that one, they're aware of it and how it hurts their partner, but that they have a personality disorder or something where they can't actually do anything about it. And so, but that is the most damaging of the horsemen is contempt. And if couples don't change that, they continue with contempt, that one predicts divorce rates with over 90%. And one of the nonverbal communications of contempt is eye rolling. And
Interesting.
so
Yeah.
when we see couples rolling their eyes at each other, now sometimes people roll their eyes for different reasons, right? Like they think what their partner's saying is silly or something, but it's
Mhm.
cute. It's not necessarily coming from a place of contempt.
Mhm.
But when the eye rolling is contemptuous, that is not a good sign for a relationship.
Yeah. I mean, because it seems to me like eye rolling is generally contemptuous, isn't it?
Yeah, it's one of the features of contempt. There's something about rolling your eyes where you're kind of scoffing at another person and you're like, oh God, they're so, you know.
I mean, I can't think of too many scenarios that aren't, contemptuous when eye rolling.
Yeah, I think I've seen some people eye roll when they are embarrassed by something
Mhm.
someone's doing, but it's not necessarily coming from contempt.
Hmm.
But yeah, most of the time in the context of therapy, couples therapy, when I see eye rolling,
Hmm.
it's contempt. Yeah.
Interesting. So that contempt is the second horseman. Let's talk about the other. What is the third?
Yeah, so the third horseman is defensiveness. It is exactly what it sounds like. It's not acknowledging the other person's point of view. It's deflecting, it's making excuses, and it can be very subtle. So it can be as subtle as just not acknowledging what the person's saying and saying like, you know what, I'm tired. I'm tired right now. Just not dealing with what's being said to you. Or it can be just straight out denial. So there's a wide spectrum of what defensiveness is, but what it ultimately is not acknowledging or addressing the point of view of the other person.
But what if you are really, really exhausted? What then?
Yeah, so when I get to the antidotes, then we can talk about that
Okay.
situation.
Okay.
Um, so yeah, I'll just go to the last one just so that I have all the four horsemen.
Sure,
And
sure.
I also made a video about this, so maybe I can send you the link and you
Sure.
can put it in the description. But
Sure, sure.
the final and there's tons of information about this, obviously, because this is coming from the Gottmans. The final horseman is called stonewalling.
Yeah, I've
And
heard
what
this one.
stonewalling is it's basically just shutting down emotionally, not engaging with with the conversation or the other person. It can be anything from just really shutting down, becoming unresponsive, and just dissociating. It can also be just storming out of the house, driving away, and ghosting the other person indefinitely. That's a
Running
form of
away,
ghosting.
it sounds like.
Exactly. So it's just it comes up when someone's feeling overwhelmed emotionally. They can be very sad, anxious, angry. It's a defense mechanism, just like all the other horsemen are ultimately defense mechanisms. They're maladaptive, which means they're serving a purpose, but they're not, you know, the most functional or healthy. Um, and so when we stonewall, it's usually because we're not feeling heard or we're feeling overwhelmed. Sometimes it could be someone's hurling abuse at us. That really can be a way of responding to that. But it's not effective and it often leaves the other person feeling completely dismissed.
Could stonewalling also be a fear of facing the reality, facing your own flaws and facing reality?
Yeah, yeah, I think so. 100%. 100%. If somebody's saying something to you that you just simply don't want to hear
Hmm.
and it's overwhelming to you or it's upsetting to you, then you might just shut down and dissociate. The key feature though is that the stonewalling piece is I am not responding to the other person.
Hmm.
So someone might say something actually in good faith and say like, you really hurt my feelings with what you just said. And if somebody, it's too difficult for them to address that, they might stonewall. Whereas someone who has a healthier response to that and more ego strength might just say, you know what, my bad, I'm sorry.
Yeah. What's really interesting is that, why we're talking about these, and just to be clear, these horsemen are the st because I might be wrong in my interpretation. They're statistically the leading reasons of divorce. Is that wrong?
Yeah, so it's not that they're necessarily the leading reasons of divorce. It's
Okay.
just that when couples use the horsemen with each other, if they don't change that, then there's a very high likelihood statistically that they will divorce.
Hmm.
Um, and that's not to say that, if it's 90% of the couples divorce, it doesn't mean the other 10% are happy, right? It just
Yeah,
means
yeah,
they're
of course.
not breaking
Of
up.
course, of course. Because I heard the
Yeah.
number one reason for divorce is financial.
Oh, okay.
Is
Yeah.
is that what you would know better than I would?
Yeah,
The,
I mean, I'm not familiar with that
uh-huh.
research.
Uh-huh.
I mean, it's interesting. I mean, there's always going to be multivariates to
Yeah.
something like
Yeah.
divorce.
Uh-huh.
I'm just citing what the Gottmans have seen in their work, in their research, which is that when they observe these, uh, those people that use the horsemen have a very low success rate.
Yeah.
It might be true that, more, I don't know if this is true statistically, but let's just say hypothetically speaking, most couples don't use the horsemen, but of those people, maybe 50% get divorced. It could be that it's financial reasons are a higher cause of divorce. It just depends on what we're measuring and the population.
Very interesting. And while you were talking about these horsemen, the word narcissism kept floating in my head because I
Mm.
noticed that a lot of narcissists avoid these things. They hate talking about their feelings. They're constantly talking down to other people. They're constantly, being contemptuous. I don't even know if that's a word. But
Mm.
they're constantly like release projecting their insecurities onto other people. So as you're saying these things, I keep thinking, that's what a narcissist would do. That's what a narcissist would do. Is that a fair assessment of what do you
Yeah, so I think there's two things, right? That somebody using any of the four horsemen
think?
is probably not going to meet criteria for narcissistic personality disorder.
Okay.
That's a very specific cluster of traits that somebody might have.
Hmm.
Um, a lot of us use the horsemen all the time. And it might not be contempt, but defensiveness is extremely common. Just, even in my personal life, I used to get very defensive. I
Yeah.
still do sometimes.
Yeah.
Since learning these skills, I try not to.
Uh-huh.
But defensiveness is really common just in everyday conversation, and it
Yeah.
doesn't necessarily indicate someone having a narcissistic personality disorder
Yeah.
or narcissistic traits. However, you are right that somebody who does have narcissistic personality disorder um, is very likely to use the horseman just because one of the features of narcissism is not taking accountability and lacking empathy and feeling superior and
Yeah.
grandiosity.
Yeah.
And so the way they speak is very often gonna use the horseman.
So yes, it sounds to me like you memorized the 10 traits of narcissism. I would like to talk a little bit more about this topic because my understanding is that only about 1 to 2% of people have narcissistic personality disorder.
Mhm.
However, and this is, I guess, a personal philosophy, I guess,
Mhm.
that we're all on the scale, not necessarily having the disorder, but that we're all on the scale of narcissism. Does that, like, narcissism is a sliding scale, but only 1 to
Mhm.
2% of people have the disorder? Is that a fair thing to say?
Yeah, I think we all have narcissistic traits
Yeah.
to varying degrees.
Yeah.
Now,
Very
if
important to establish that.
yeah, and I think there's such a thing as sometimes in psychology we talk about healthy narcissism. So
Interesting. I'd love to talk about that.
yeah,
Yeah.
so narcissism, and again, this is actually not my area of expertise, so I'm gonna do my
Okay.
best here.
Okay.
Um, but when we talk about what is considered narcissistic personality disorder, it means that you have these traits, and they're basically rigid, and they've existed for a long time, and they're often uh, causing lots of problems in your social and emotional functioning. Now, there's a difference between people sometimes having fantasies of grandiosity,
Hmm.
oh, imagining I'm winning the Oscar or I'm getting the Nobel Prize or I'm on television and as the number one psychologist of the time, right?
Yeah. Yeah.
Now, that's different, and I actually think very common that we have grandiose fantasies
Yeah.
from somebody who genuinely believes these grandiose fantasies,
Hmm.
feels entitled, um, and reaches a level of rigidity that they're not aware that what they're saying is actually not reality based.
Delusional.
Yeah, yeah, it
Yeah.
can be a delusional level kind of they're not reality testing in the way that somebody who's like, yeah, sometimes I imagine I'm a superhero and I'm saving New York City, but I know that I'm not that. I have that humility or I have empathy for other people. Somebody who has a narcissistic personality is going to be very elevated on the scales that we all have to some extent. It's just that we're more balanced and they don't reach that extreme level of entitlement, grandiosity, lack of empathy, um, and other behavioral traits that we often see.
So, because you mentioned the phrase healthy narcissism before. So
Mhm.
what I'm hearing is that it's okay to have a tiny, tiny bit of these traits.
Well, I think, healthy narcissism and it's kind of we're getting into something that's kind of semantic,
Okay.
I don't think narcissism in the case of what people often talk about, which is like a lack of empathy, um, and kind of toxic grandiosity, I don't think that that's healthy. And the reason it's not healthy is because um, it's blown to such a proportion that it's actually harmful to yourself and other people.
Yeah.
Healthy narcissism, what I really mean by that is kind of there's a level of self-esteem, having confidence in yourself, valuing yourself, taking care of yourself, feeling that you matter, which I think is actually healthy, right? So someone with very low self-esteem, which we would
Hmm.
typically say is like the on the opposite side of the spectrum
Hmm.
of someone who's narcissistic, at least the way that they present, right? We could talk
Yeah.
about the unconscious, but they might say something like, "Oh, I'm so worthless. I don't deserve to be happy. I don't deserve to set boundaries with other people because, I have no value." We would want to work towards actually developing some narcissism of, no, you do matter. Like you actually have value.
But
You do have
is
strengths.
feeling that you matter fair to call narcissism?
Yeah, on some level it's not. I think it's just
Uh-huh.
how we kind of use the terminology sometimes. This is more
Uh-huh.
in like the psychoanalytic
Uh-huh.
world, which I'm not an analyst,
Mhm.
but that sometimes we discuss healthy narcissism.
Mhm.
Um, Not to say that it's even really related to the narcissistic personality disorder,
Mhm.
but for example, going to therapy in some sense is allowing yourself to feel that you matter enough to
Mhm.
be the center of attention
Mhm.
to someone else in a therapeutic relationship. And we would actually say that that's a good thing, that you're
Yeah.
actually, this is a space where you matter and we all deserve that. And so it can turn into narcissism, right? If you're like entitled to the experience. But I think for most people, vast majority of people go to therapy, it's a healthy relationship with yourself in saying, I deserve to be paid attention to, I deserve to be listened to and heard and seen. And a lot of people who are depressed or anxious who end up in therapy, uh, they're actually on the lower spectrum of self-esteem. And so we're actually trying to help build self-esteem.
Yeah, which can be an extremely difficult bridge to, gap to bridge. So I'm
Mhm.
wondering how do you do that? Because I know that a lot of, self-esteem starts in childhood, which obviously none of
Mhm.
us can change, can't go
Mhm.
back in time. So I'm wondering, how do you help people bridge that gap between, having a low self-esteem and being more confident?
It's a good question. Depending on which therapist you ask and which modality they use, they're going to have different answers.
Yeah.
I think for me, in my experience, this is what the research indicates as well, is that the most important feature of therapy for uh, effectiveness is having a good relationship between the therapist and the client. So it's not so much about the analysis you do. It's not about your training. It's not about the type of interventions you use. And there's lots of different ones, like Gottman is a type of intervention.
Hmm.
It's about having a positive relationship, a working alliance between the therapist and the client. And I think that when a therapist genuinely cares about their clients and really believes that they matter, that becomes something that the client can internalize. And so if a client grew up with parents that were neglectful or abusive and didn't validate their feelings, didn't tell them it's okay to be who you are, even the parts of you that are embarrassing or we're ashamed of, that can create low self-esteem. And when you have a therapist who's able to accept you as you are unconditionally, I know it is conditional to some extent, right? Because we're getting paid and all of that.
Yeah.
There's professional boundaries.
Yeah.
My approach is to, with my best effort, really accept and see people as they are for all their traits. I think that over time can help people develop a healthier self-esteem.
So what I'm hearing is the number one most effective technique is to make your clients feel like they matter unconditionally, regardless of necessarily the topics or modalities, just to make them feel like they matter.
Yeah, or that the relationship between the client and the therapist is strong. And so part of that is feeling like this is someone who has my back, who supports me, who hears me, who will consistently show up. That is what we've seen as being the most effective aspect of therapy.
Yes, this is super interesting to me because this is all brand new information to me. So
Hmm.
thank you. I'm really enjoying this conversation. So, okay, I have a friend, because I'm in school to be a therapist right now.
Oh, cool.
And I have a friend who said something kind of interesting. He said, "You're too judgmental to be a therapist." And I'm
Yeah.
wondering, because everyone has their own answer to the question I'm about to ask. Is judging necessarily a bad thing? And is it okay to be judgmental as a therapist or as a person?
Yeah, I mean it's a good question. I think it's a complex topic. You know, as human beings, we're going to judge certain things for many,
Mhm.
many
Mhm.
factors. It could
Mhm.
be, because we feel disgusted by something because, like for example, human beings pretty much across the board are disgusted by the idea of incest.
Sure. Yeah.
And so even if you're a therapist, right, if you hear something about incest, most people are going to have a visceral feeling of disgust or
Yeah.
that negative response to it.
Yeah. Yeah.
Now, that becomes tricky when you might be working with a client who's experienced sexual abuse from a family member, which in the therapy world is actually relatively common.
Or who's done it himself.
Yeah, or who's done it himself. Yeah, yeah.
Yeah.
And so we'll use an extreme case, right? So let's say you have a client who has you know, has sexually abused a family member
Hmm.
and is in therapy and discusses that. Now, almost all therapists are going to have a response to that, right? Because that's how humans are wired, and it's
Yeah.
very, very taboo.
Hmm.
And it's sad, and sexual abuse is something that we're all sensitive to.
Yeah.
On some level, as a therapist, part of the process of, in my opinion, doing this work is to still try to understand the client for who they are.
Hmm.
Now, I have worked with clients who have done things that are, violent crime and stuff like that.
Hmm.
And I still want to understand their perspective here and say, okay, given who you are, let me understand why you did what you did and how you
Hmm.
feel about it. Now, if someone is abusing children, for example, we have to report that, and it's for the better, right? Because we want to
Of course.
protect children, we want to protect innocent victims.
Of course.
And if we're going to create a therapy client relationship that is genuine and accepting, I think it's okay for the client to know, one, I don't agree with what you've done, but I still want to understand who you are and be there for you through your goals as a client.
I still want to have empathy for you,
Yeah, still want to have empathy. And it's hard to empathize with something, right? That's a very extreme example. But I've had
but it
clients,
happens.
it does happen.
It
Yeah,
happens.
I've a less extreme case is I've had clients who have cheated on their partners.
Okay.
And that's something where, if you hear your friend has been cheated on, right? We very quickly go to, oh, what a piece of shit, right? I
Yeah.
can't believe
Yeah.
they did that to you.
Yeah. Yeah.
And we judge it.
Hmm.
And that's all, it's a natural response.
Hmm.
At the same time, as a therapist, when I've understood what's happening that led to this behavior, there's a whole story behind it that we can have compassion for because most people aren't doing that because they just want to purposely hurt other people.
I also want to, I believe that having compassion and judging are not mutually exclusive,
Hmm.
right?
Hmm.
You can judge and have compassion. And I think that's
Yeah, yeah.
important to talk to establish, I think.
And I think it also depends on what you mean by judge, right?
Yeah.
If
Yeah.
judge is just, oh, you're a terrible person,
Hmm.
that's one form of judgment. Another
Hmm.
form of judgment is I don't agree with what you did, and I think that what you did is harmful, and I won't condone it, and I want to actually do what I can to protect others from that behavior.
Yeah.
That can coexist with, and I also understand that there are reasons why you did that that I can have empathy for, and I can be compassionate towards you as a fellow human being. those two things can exist at the same time.
So to go back to the first example, you're a terrible human being.
Hmm.
I believe that you can believe someone is a terrible human being and still have empathy for them.
Yeah, yeah.
Like if when I'm a therapist, and even right now, like in my podcast, I made a promise to myself to always have empathy and compassion for the people I'm speaking to, even if I view them as a terrible human being. Like if I
Hmm.
were talking to a rapist, I would view them as a terrible human being, but I
Hmm.
can still have empathy towards them.
Hmm.
So they're not necessarily mutually exclusive.
Yeah, and I think, I think part of this too is having an understanding as well that we're therapists or human beings.
Yeah.
And sometimes there might be a particular population that you just might not be good to work with, right? When
Mhm.
your personal feelings get in the way of your ability to work effectively with a client and have empathy or compassion,
Yeah.
then it's okay to also say, you know what, I'm not going to work with this population,
Yeah, that's
right?
your boundary. That's your own boundary.
Yeah, and that's fine. There's lots of therapists or psychologists that don't work in forensics because they're like, look, I just don't want to work with people that have committed horrible sex crimes and stuff like that. And that's okay, right? But people have different expertise and niches that they want to work within. And I respect that too. I think it takes a level of awareness and maturity and professional ethics to also know your limits about who you can and can't work with.
Yeah, it's funny because even though I'm still in school, I think I'm gonna work with anybody, man. Like there's actually
Mhm.
even a part of me that wants to work with murderers just to see like how they think.
Mhm.
So just to be clear, and maybe I'm wrong, your degree is in psychology?
Yeah, so I have a PsyD. I'm a licensed clinical psychologist, and that's my background.
Okay. But do you mostly do couples therapy or do you mostly do individual?
I do a lot. I do a mix of things. I work with couples, families, and individuals.
Okay.
I would say that a lot, I've worked with lots of different clients. Right now, what I do, I work in private practice. I work with a lot of working professionals. I actually work with a lot of gay men, has become kind of
A lot of what?
popular. Gay men.
Gay men? Oh, gay men.
Yeah,
Okay.
gay men. I'm not sure how this happened, but and I really enjoy it, and it's not something that I went into school thinking, I want to work with gay men necessarily. Now, some people do that, right? They have a particular population,
Yeah.
but it just turns out that's a lot of the clients I work with. Um, I work with a lot of graduate students. I work with the families I work with. It's a lot of work between parents and adult children. So
Hmm.
it's often children in their 20s and 30s that are having issues with their parents and they're trying to work through that. And so,
Children in their 20s and 30s.
yeah, so it's like their children,
Yeah,
right?
yeah, yeah.
So yeah, that's a lot of the clients I work with. I work with a lot of Asian and South Asian clients as
I
well.
have a theory to the gay men, like, because they come to you, right? You don't come to them.
Yeah, I don't advertise myself as being somebody who specifically works with the LGBTQ
Uh-huh.
population. Now, I do have experience with that,
Uh-huh.
but it's not something where I'm like, I actually advertise myself more as someone who treats anxiety and life transitions and and couples. And so I think sometimes the way that I work, I'm a very existentially based therapist, which means I care a lot about looking at not just you know, we're in therapy, we're treating symptoms, etc. But why is it important for you to work on these symptoms? The why question is a big factor, and
Yeah.
so I think a lot of people are attracted to that. And I don't know, maybe it's because of where the practice is located. I'm not sure, but I've just happened
You're,
to
you're in New
work.
York, right?
I'm in Chicago.
Oh, Chicago. Because I heard you mention New York before. You said
Yeah,
something.
it's Dr. Orna, who's the psychologist in couples therapy, the show that
Uh-huh.
we're reacting to. She's based in New York.
I see. So I have a theory to the gay men. So one theory is that a lot of women prefer female therapists. I'm sure there's some that don't. And I would also
Mm-hmm.
imagine that a lot of straight men sort of have the mentality of like, I don't need a therapist. Like
Mm-hmm.
real men don't need therapists, where I think gay
Hmm.
men might be a little bit more receptive, a little bit more open-minded to
Mhm.
seeing a therapist. Is that a stupid theory?
No, yeah, I mean, it's, I haven't seen any research on this.
Mhm.
I think that there's probably lots of gay men who would prefer to work with a male therapist,
Mhm.
just because there's that empathy, even if, they don't know about my sexuality.
Mhm.
Um, I know lots of women who would prefer to work with a woman therapist.
Yeah.
And so, yeah, that could be true. Yeah.
Yeah, and also it's men and women live very, very, very different lives. We live in a different world. So, if a man prefers a male therapist, that might make more sense in certain ways because a male can empathize with them in a way that a female might not be able to, correct?
hmm Yeah, I think it's both true. And I also think that, you know, in my experience, I've worked with a lot of women,
Hmm. Hmm.
and a lot of the women I've worked with have said that they might not, I don't know exactly how many, but quite a few of them have actually told me that they were hesitant to work with me because I'm a man. And they found that it was actually very healing to see that they could work with a man and do the work that we did together. And so I think sometimes we expect that it's going to be uncomfortable working with someone who might be different, they won't understand.
Uh-huh.
But that's not always the case. Sometimes I think working with someone that maybe you feel anxious about working with can tell you something about some internal dynamics that it could be healing to work with someone who represents someone who you think won't be able to understand you. And then when they are able to empathize, uh, it can be really positive.
Well, cross your fingers and hopefully they don't, that they surpass your expectations because I think that a lot of men can be really bad listeners. And I think that's why a lot of women might prefer a female therapist. So, hopefully
Mhm.
the ones who do see male therapists, their expectations are surpassed and which can be very, very healing. So you mentioned the word antidote before when we were talking about the four horsemen. You
Mhm,
mentioned
mhm.
the word antidote. So let's talk about the antidotes to them.
Yeah, so backtracking back to the communication skills. So what
Mhm.
I do with pretty much all my clients is we look at, are you using the horsemen, which are right, it's complaint or sorry, that's one of the answers. Criticism, contempt, defensiveness, and stonewalling. And so for every horseman, there's an equivalent antidote that when you start using the antidote instead of the horseman, uh, it really changes the how you feel, it changes your relationships all in a positive direction. Um, so the antidote to criticism is to make a complaint. So
Go ahead. I'm
okay,
listening.
okay.
Yeah.
So I wasn't sure if you can ask a question, but so a
No, no, no. Go ahead.
complaint, when we criticize, we often actually have a complaint. And so what a complaint is it's talking about something specific we'll say in the context of couples, but it can be with anyone. Talking about something specific that your partner has done and how it made you feel. And opening up a dialogue for a collaborative solution. So there's an actual formula that you can use to do a complaint, which starts with, I feel this emotion because of this specific thing you're doing. It has to be specific. And then you open up the dialogue for, is there anything we can do about this together? So a criticism is, I can't believe I married you. You never take out the trash. You never clean. What's wrong with you? A complaint is, I feel frustrated when I come home and you haven't taken out the trash, especially when we've talked about it. Is there anything that we can do to help this situation?
It's interesting because
Take out the trash.
it's such a small change of phrasing, yet
Yep.
the change in phrasing changes the entire dynamic.
Yep. Yep. Exactly.
I
So,
feel the words I feel that makes it more subjective, doesn't it? The words I feel makes it a subjective experience as opposed to an objective claim.
and you're starting with vulnerability. So you're talking about yourself. You're
Hmm.
talking about how it makes you feel, which puts the focus not on the other person where they can get defensive,
Hmm.
but now they're actually in a place of empathy. So if you feel frustrated, if your partner says they're feeling frustrated with you, and they mention something specific, not you never clean, right? Which is probably not true, but you didn't take out the trash like we talked about this morning.
Mm.
And they
You
say
must get
what
that a lot, huh?
it's just a generic thing. But yeah, cleaning, stuff like that between partners
Cleaning is a
is
big one, I know.
yeah, yeah,
Cleaning. Yeah,
yeah,
yeah.
yeah. Yeah, there's lots of things. But this formula works for any complaint. Uh, Rarely does the other person not become more open for dialogue here. So that's a complaint, and that's the antidote. So instead of making a criticism, you do a complaint. The next antidote is for contempt. This one's hard if you're feeling contempt, but it's
Yeah.
just to remember that's just respect and admiration or love. It's reframing your perspective to actually think about your partner's positive qualities. And the next step is to actually maybe say it out loud. So if you're feeling contempt, like, oh God, you're so dumb, you never remember to take out the trash. The antidote is to think about positive qualities about them, remember they're a human being, and then to say that. So I really appreciate, how much you typically clean around the house and how much you show up for the relationship. And I'm also feeling frustrated because we talked about the trash this morning and you didn't take it out.
So to start with a compliment.
Yeah, so it's called a gentle startup in
Mhm.
Gottman, which is to, yeah, basically start with a compliment or something positive about your partner. You don't necessarily have to say it, but the antidote to contempt is to at least internally start to think about your partner from a positive
Which
perspective.
is extremely difficult when you're angry.
Yeah.
Extreme, it takes a lot of mental fortitude to think
hmm
positively about the person that you're angry about when you feel like they screwed you in some sort of way.
Yeah. So what it's doing is it's teaching you to activate your kind of your wise mind or your more adult mind. It's
Prefrontal
activating your
cortex.
prefrontal cortex,
Okay.
exactly. And you're no longer letting your emotions take you away with the situation. You have to stop and actually think. You have to have mindfulness.
Which is
You have,
extremely difficult for most people. The best example is
yeah.
politics, right? Think about like how bad are people at going, let me stop and think critically in the context of politics, all right?
Yeah, or thinking about how it's making you feel, or
How it's making
humanizing
the other person feel, you mean? Or
the other person and yourself,
okay.
right? Someone says something that you disagree with politically,
Hmm.
and you start to get flustered, you start to get angry, maybe you start to get anxious.
Yeah.
A lot of people will, instead of thinking about why am I feeling this way, what am I feeling? Can I label what I'm feeling now? They just go into defense mode or attack
Yep.
mode.
Yep. Yep.
It's like the
And
fight or flight
I believe
response.
that insecurity is the number one reason why they go into defense mode.
Mhm.
Would you agree with that statement? You can push back.
Yeah, I mean, I think insecurity can be a reason. I think, there's deep reasons for why, politics are very important to people because
Yeah.
ultimately it's connected to our survival,
Yeah.
right? And our values and our deep beliefs. And so when somebody says something that is counter to that, it can make us feel threatened and unsafe. And so that's why we can go into the fight or flight mode. Um, That's why we say, no religion and politics at the dinner table is because disagreement about these things that are so deeply embedded in our value system can be very dysregulating.
Yeah, and I like the word unsafe, because nobody, whenever we have people, political debates or any sort of debate, I can't think of a single time a person said, you know what, you made me feel unsafe with that comment. And I feel like
Yeah.
that's something that people just don't say or even think. They just
Mhm.
automatically think about, ways to get the other person back. Like
Yeah.
how to get a gotcha moment as opposed to like this person's making me feel unsafe. And even if they felt it, they might not say it out loud.
hmm
So let's move on to the third horseman. Well,
hmm
sorry, what was the third horseman again?
Yeah. So the third horseman's defensiveness,
Defensiveness.
and the antidote to defensiveness is taking responsibility,
Accountability.
accountability. Yeah. So this is really difficult for a lot of people. Something that I use here with my clients is I call it the 1% rule. Um, Irvin Yalom is a psychiatrist, very well known existential therapist and writer, and I think he might have maybe coined this, or I know he's read about it, so I didn't invent the 1% rule.
Hmm.
But
Hmm.
what the 1% rule is, in the context that I use it, is you can disagree with 99% of what's being said. Find that 1% that's true that you can validate and acknowledge that. So someone says, God, you're so annoying, you're so lazy, you never take out the garbage, right? This contempt, criticism, to take responsibility, to avoid defensiveness, instead of acknowledging and validating all that's being said, you can say, you're right, I didn't take the trash out this morning. You're right. Now, that's hard to do when someone's being contemptuous and critical, but in most cases, if you take responsibility for what's true, the other person's going to actually concede and they're going to become more regulated and it's going to be more productive. Whereas if you get defensive and you say, well, you didn't remind me, we're often, it's just, yeah. And that's what I
No,
see with
I'm
some
just laughing
people.
because I can think of so many examples, like real life examples that I know. So what's
Yeah.
interesting about this horseman is that it requires another horseman before it, right? Like defensiveness re
Mhm.
first requires some sort of criticism beforehand. Um, and I wrote down three words. I wrote down being right and sorry. So, and th I think this is the perfect time to bring it up because I feel. What I notice is that the words "I'm sorry" is so much more effective at making relationships and marriages last
Mhm.
than being right.
Yes.
And
I
that,
agree.
I don't know if you watch Dr. K on YouTube, but he talks a lot about how like being so, like saying the words "I'm sorry" and like just saying sorry even when you're right. I wrote a best man speech for my friend who got married
Oh,
about
cool.
10 years ago. And then it was I put it in the form of like a poem or kind of like a poem slash rap. And the in the end of the poem I said I was talking a little bit context. I was talking about how he was telling me one night just say sorry to a girl that I used to talk to back in the day. And
Mm.
in the end of the poem I said he said, Christian, this might make you tight, but you gotta say sorry even when you're right. Words of a real man, because real men don't fight. Drowning in my ego till Eric made it right.
Oh,
And
wow.
I just really want to talk about well, would you agree that the words "I'm sorry" is much more effective than being right?
Yeah, I think generally that's more effective, especially in the context of your intimate relationship.
Yeah.
The power of saying I'm sorry is people really underestimate it. And often when we don't say I'm sorry, it's because of pride, right? It can be ego. It can also be shame, right? That to apologize is to acknowledge that we've done something hurtful. And that can be difficult because saying sorry is taking accountability.
Yeah. Yeah.
Now, you don't have to say I'm sorry to take accountability in the case of the antidotes, right? You can just acknowledge what the other person is saying. You can reflect back to them. So reflecting is saying back to the other person what they're saying to you. And it can be verbatim. It seemed like it would be unnatural. And it kind of is because it's not really how we talk, but it's very regulating for somebody to hear back what they've said. That can be taking responsibility is to just verbally reflect back to the person what they've said to you,
Mm.
not passive aggressively, but in a sincere effort to understand them. Now, if you've done something that has hurt someone, saying sorry is complicated because we don't want to be at risk of over apologizing too.
Interesting. Interesting.
But
Yeah.
look, if you elbow someone in the face accidentally, we say sorry even though we didn't mean to do it,
Yeah. Yeah.
right?
Yeah.
And so you can be not at fault and still apologize for something, and it's okay. And in the case of couples therapy, I think being right when I see couples fighting, being right is something that's getting us into trouble. And we,
Yeah.
we want to move towards apology if that's necessary.
Mhm.
And some people they didn't grow up hearing parents apologize or they were told you never apologize. And it's yeah, learning to apologize effectively is very helpful in life.
You know, it's interesting because I used to be an Uber driver, and I remember I had these like 20-year-old boys in my car one day, and
Mm-hmm.
I was quiet the whole ride, but I heard one of them saying to the other one, "Never say I'm sorry to your girl. Never say I'm sorry because then she'll look at you like you're weak, like you're a bitch." Never, and I'm
Hmm.
thinking, you know, I'm an Uber driver, so I'm thinking in my head like, this freaking 20-year-old doesn't know anything. Good luck with making a relationship last with that mentality. You
Hmm.
also said something that reminded me of a YouTube video I watched with Jordan Peterson a while back,
Hmm.
and you know, I know he's a little bit controversial, but
Yeah.
he said one way to make marriages last and is a technique, and maybe there's a word for this technique, which you were talking about, is rephrasing what they said in a way that they're satisfied with. So they have
Hmm.
to agree before you move on, before you move on to the next step, they have to agree with your rephrasing of
Yeah.
what they said.
Yep.
I think it's a brilliant rule.
Yeah, yeah. And so the Gottman use that as well. That in dialogue, you're trying to get people to do exactly that, to not just say back what they're saying, but to show that they understand it. Um, I'd say that's like 80% of what I'm doing as a therapist is by reflecting and empathizing to the best of my ability, I'm indicating to the client that I'm understanding what you're saying. And you can tell when you get it wrong, and you can tell when you get it right a lot of the time because people will often smile because they're like, "Oh shit, you actually are understanding me."
Yeah.
And it's very, very be very healing to actually be heard by someone and to have them say back to you and get it right. Yeah, I get it. This is what you mean.
Yeah, one of the biggest complaints I get, especially from women, is, you know, he's not listening, like he's not really understanding. I know that we're a little bit pressed for time, so let's get to the fourth antidote, uh,
Hmm.
to wrap it up.
Yeah, yeah. And it's okay. We can go a little bit over.
I
It's
would love to
fine.
go over, to be honest. I would love to go over.
Yeah,
To-
I've got something, but like we can do like another 15 minutes.
I would love to go over
Yeah,
because
yeah,
I
yeah.
have a lot more questions. So
Yeah.
yeah, let's talk about the antidote.
Yeah. And then also if you want, I'm also happy to do a part two if that's
I'd
something
love
you
that
see.
too. Yeah, I love that.
And also I appreciate this. This has been a fun conversation, so I
Yeah.
appreciate this.
No, I like, you know, there's a little bit of pushback, which I like.
Mhm. Okay, so the final antidote is to stonewalling is self-soothing. And self-soothing is quite simple, actually. It's just it's two things. It's one, doing something to calm yourself down. And that can be different for everyone. So some people it's I'm gonna go for a walk, some people it's I'm gonna listen to music. Often it's just I need to get space from this situation because I'm feeling too angry or whatever it is. But it's not just doing that, it's also communicating that and having agreement about what's going to happen with your partner. So, hey, I'm feeling overwhelmed and angry, to be honest. And I feel like this conversation is not, we're not going to get anywhere. So I'm going to take an hour and I'm just going to go for a walk and then let's come back to it. That's self-soothing because you're doing something intentionally to calm down your nervous system, but it's collaborative. You're making this decision with your partner and you're coming back to it. You're not just ghosting and leaving them hanging, which can be very, very painful and hurtful to ghost your partner and just leave them hanging.
Oh, it could be traumatizing. Yeah, I mean,
Yeah.
yeah, it's, you know, I don't see any evidence that like ghosting is any less traumatizing than like even verbal abuse. You know, ghosting can be extremely tra
Mm-hmm. Oh yeah.
I'm speaking from personal experience when I say this.
Hmm.
So I have a question that I think is important. So I noticed that all of these antidotes are extremely difficult to incorporate when you're angry and when you're emotional. Like, you know,
Hmm.
and for some people, I mean, I don't know if I want to use the word impossible, but my question is, how do you get better at incorporating these antidotes when you're feeling angry, when you're emotional? How do you develop the self-control to incorporate these antidotes?
Yeah, I mean, so this is why I think therapy is important because what I will do with couples is I will have them practice having conversations, arguments in front of me.
Oh, so there needs to be a referee.
Kind of, yeah. On some
Yeah.
level, it is
Yeah.
like refereeing, and it
Uh-huh.
says, okay, we had this conversation. It totally escalated. We didn't get anywhere. I say, okay, let's have it again right now.
Hmm.
And as they're getting angry, as they're starting to go into criticism, we will stop and we will say, okay, let's try that again. What are you feeling right now? Let's try it as a complaint. And so it really just comes down to practice. Now, you're right on some level that once you're already at that point of no return, sometimes you just got to go to self-soothing because it's just going to be too hard. And that's why we have self-soothing. Now, couples therapy, practicing this in the room is one way to get better at talking about your feelings and develop more
With a
self-awareness
mediator.
with a mediator. And then there's lots of other techniques, which it really just comes down to mindfulness and meditation. I'm not talking about like religious Buddhist meditation. I know that that's great. There's lots of stuff there, but from a secular perspective, meditation, mindfulness, just paying attention to the present moment and anchoring yourself to the sensations that you're feeling. Often that's breathing as an anchor point. That is calming the nervous system and it's getting you more in touch with your body. And the more we do that, the better we get at these moments. Now, meditation is hard. A lot of people don't do it. I don't do it nearly enough.
Mhm.
There are lots of other ways. And so, um, another way to get better at this is what some therapists say, strike while the iron's cold.
Interesting.
So what that means is we're gonna have difficult conversations when we're calm. So for feeling angry or upset, then we say, you know what, we're gonna come back to this later. And then you come back to it at least when you're starting from a baseline that's lower. That way it's gonna be easier to manage.
That sounds way more effective than communicating when you're angry. Way more effective.
Yeah, and so part of it is actually just not communicating when you're angry at that level and having the awareness to say, let's come back to this later.
So what do you do when you simply have two different belief systems? When two people are calm and they have an intellectual conversation, and at the end of the day, they just don't agree and they have two different belief systems. You know, one person, let's use a common one.
Mhm.
Let's say the man, uh, let's say the man doesn't want to do any chores, right? Some men are very like anti-chores. We talked about the cleaning before. I
Mhm.
actually have a friend who's pretty anti-chores, and the woman says no, like it's not fair. Like I'm working too, like you have to chip in with the chores. What do you do when you have two people who just have different belief systems?
Yeah, I mean, that's an interesting case. If I had a couple that the man was just hell bent on, I'm never gonna wash a dish, I'd want to
Yeah,
understand.
I see it all the time, man.
Yeah. That's not something I've seen. I don't think someone who's like that rigid about it,
Hmm.
but I would want to understand his perspective here again. Like, what does it mean for you to not clean chores? Like, how is this connected to your sense of self or your beliefs about what it is to be a man in a relationship? What does it feel like for you to change some of your behaviors? What's going on there? I'm not going to try to change him and say you have to start doing chores. I would want to understand what it means for, in this case, the woman. Why is she asking for this? Why is it important for her to get support? Is there any way that they can care enough about each other's perspective and respect the relationship to change in ways that might be helpful to the other person? Now, sometimes I'm imagining a situation where let's say the man genuinely is like, I'm not going to do any chores. I'm hell bent on that. And the woman says, well, I don't want to be with somebody who doesn't do chores. Then maybe they're just not compatible and they're 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 going to need to break up.
And how often do you suggest a breakup in couples therapy?
I don't think I've ever suggested a breakup. I think my goal is to help the clients come to a better understanding of what it is that they want in a relationship, get better at connecting with their emotions and being truthful and authentic. And sometimes that leads to a breakup because of the couple or one person in the relationship deciding that because of circumstances, because of where we're at, I don't think we're right for each other. And I will respect that. Couples therapists aren't there to keep couples together.
Mm.
It's to help couples work on their goals and get closer to an understanding of themselves. And sometimes that means breaking up, and often it means that they actually don't break up. But it's not for me to decide, I think. I think I would want them to reach a point where they are making an autonomous choice.
Autonomous.
Yeah.
See, so I have a friend who's going through something with his ex right now, and they're still like kind of seeing each other. And
Hmm.
he basically asked me like, Christian, like I know that you're not a licensed therapist yet, but can you do like some sort of like a like some sort of like couples counseling via
Hmm.
Zoom? So I said yes, and she agreed to it as well. So we
Hmm.
did it, and I realized that for me that was way more challenging than just speaking to someone one on one. I
Hmm.
noticed that it required more like putting my foot down and more like being assertive. Like it required way more being assertive than I'm used to,
Yeah.
and then even than I'm more comfortable with. Have you also felt
Hmm.
that as a couples therapist?
Yeah, but definitely, definitely. And it's true with families too, that the role as a therapist is often more directive. And it's because sometimes they're getting triggered by each other and things get escalated. And so sometimes you really have to say, I'm going to stop you now. Um, I'm going to stop you. This is getting to a point where it's not productive,
Hmm.
and you've got to kind of manage the situation. And it can be really challenging. And for new therapists, it can be really, really hard to learn how to do that, to be assertive in your role as a therapist while also being respectful. It's not something that I was great at first. Interrupting clients, for example, is,
Yeah,
is a
yeah,
difficult skill.
yeah.
But I love it. I really enjoy it. So,
Yeah, it's definitely challenging. And I'm wondering what you do when you have a couple where one thing is good for one person and it's bad for the other person. So, for example, maybe you feel like one person just needs the other person and the other person doesn't feel like they need the first person. Like, what do
mhm.
you do when the needs are very different?
Yeah, I mean it's a good question. I think every couple is different. So, if someone truly doesn't need the other person, then I would be curious why they're coming to couples therapy to begin with.
Mm,
You
mm,
know,
mm.
I think that when people reach a point where they genuinely feel like I just don't need this, and they will leave the relationship.
They won't even go to couples
Um,
therapy.
yeah, I mean, I would wonder why someone's going to couples therapy who is saying I don't need this, because it's a little bit paradoxical,
Interesting.
right?
Yeah, 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 yeah.
Um, I think, it's an interesting question. I'm not really sure. Um, I think sometimes what is being said is not necessarily what's actually the truth, right? Someone might say, I don't need you anymore. Begs the question, why are you here talking about this? Why haven't we broken up yet? And there could be many factors for that, right? Some people are really trapped in relationships because of economic reasons,
Yeah,
cultural
yeah.
reasons,
Money is a
religious
big one.
reasons, money, yeah,
That's a big
money.
one.
And that might be a situation where someone's like, look, I don't need you. I don't want to be in a relationship with you, but it's just too much of a financial risk to get a divorce right now. That is possible. So I think it's hard to answer that without having a specific case.
Yeah. Yeah, no, that's a good point. I mean, if they even go to the couples therapist in the first place, then I guess it's safe to assume that they both want it to work.
Usually there's hope on some level for both people, at least initially. That's what I've seen. Yeah, there's some hope. It might be a little sliver of hope. But
I don't
yeah.
know. Do you watch Dr. K on YouTube?
Yeah, yeah, yeah. I really like Dr. K.
Actually, I think that might be how I found you, if my memory serves me correct. Did you do a
Yeah.
video on him?
Yeah, so I reacted to part of his Jubilee video
Okay.
with people who are depressed.
Okay. So
Yeah.
I think that's how because I watch so many YouTube videos, but I think that's how I found you.
Hmm.
And he said something really interesting. I'm sorry, what was the topic we were just talking about? I'm sorry.
We're talking about what if someone doesn't need another person?
Oh yes, yes. So he said something really interesting in a video. He said how one of the main reasons why men don't go to couples therapy is because they feel like the couples therapist essentially gangs up. They side with the woman and they feel
Mm-mm.
ganged up on. Did you hear about that theory or that statistic?
Yeah, I think that, I don't know about the statistics or research on that. I do think that gender plays a role in the dynamics in the room, and that can go both ways. So when I'm working with a couple and it's a heterosexual couple, there's always going to be an imbalance for the woman because there's two men in the room. And inversely, right, if there's a woman therapist with a heterosexual couple, the man is going to be a minority in that situation. And so this is why I think it's important to address that in the room with the clients and talk about it openly, right? A lot of so I know about a therapist who's a psychologist who, when working with couples that it's a man and a woman, will say, "How are you feeling about being in a room here where you're the only man?" And open up a dialogue about, is there any concerns about not being heard or, not empathized with? And I think that's that's typically associated with feminist therapy is acknowledging gender and the politics that get intertwined in the therapy room. And I think that can be a great thing to be. I think you have to be aware of it as a therapist. And I think it's true that many men and women feel that way. And I think as therapists, we should be aware of that and intentional about how we address that.
Yes, and so I do. I know we have to wrap it up, but you mentioned the word feminist, so I want to ask one last question. What
Mhm.
do you do when you have like a woman who's a feminist and a man who is the opposite, whatever word, anti-feminist, maybe a red pillar? Because this is
Right.
very, very common. I'm sure you see it all the time, where the woman's
Mhm.
a feminist and the man is like, I don't want to use the word misogynist, but maybe just not a feminist. So what do you
Mhm.
do in that situation?
Yeah, I mean, it is an interesting question. I think that in that situation, I think it's going to be hard to see. I mean, I don't know. It sounds like you've seen maybe different people than
All the
than
time.
I have.
I know so many couples who are like this.
Yeah, when we're thinking about like kind of like the Andrew Tate manosphere type
Yeah. Or just
men.
not a feminist, let's say.
Okay, I mean that's different from someone who's like down that
Red
area of the
pill, red
manosphere,
pill.
the
Yeah.
red pill,
Yeah.
yeah.
Yeah. Yeah.
Um, Again, I think there's truth to both sides.
I
And
agree. I
yeah,
agree.
in good faith, if I'm working with a couple where let's say the woman identifies as a feminist and the man doesn't identify as a feminist, I'd want to understand his beliefs and her beliefs, why they're important to her. And if there's ways in which they can connect and understand one another, um, deeper than the label, right? Because just the word feminist can bring up feelings for just about anyone about what that means to them. And I would want to understand what's happening on a deeper level rather than getting into defining what does it mean to be a feminist and all of that. It's not a debate. That's not what couples therapy is.
Even though I'm sure it turns into one.
It
And by
can,
the
yeah, it
way,
can.
I really love how the first step was always understanding. Whenever I would ask, like, how do you deal with this? How do you deal with that? I did it like 3 or 4 times. And the first step was always understanding, which I think is the most important first step. And I think that people, whether you're a therapist or not, people really, really need to understand that the
Mhm.
first step should be understanding. Dr. Ashi, it was great talking to you. I definitely want a part two, maybe next week or whenever you're available, man.
Yeah, it was great to meet you. I appreciate that you even asked me to do this, and yeah, we'll keep in touch.